Hi and welcome to Hoxton Therapy. This is a narration of one of our articles. Long-term impacts of Covid-19 on mental health. The Covid-19 has significantly increased our anxiety levels, and experts have warned that a good number of us could suffer more seriously due to the mental health implications going forward and after the pandemic. Dining out at restaurants with friends and relatives and attending book clubs, it is revealing that Susan Kemp has had a perfect social life before coronavirus. Since April, when the lockdown began, she moved out of her apartment near Stockholm only 5 times after struggling with sudden social anxiety symptoms from obsessive-compulsive behaviours due to the pandemic. In her experience, open quotes, "It's like the stress makes me pass a breaking point where I was able to regulate better," close quotes. Kemp in her 30s, and she's a copywriter and also a part-time student. She frequently gets afraid thinking of public transport, the cleanliness of cutlery and the glass at the restaurant, and imagines the images of viruses cells lingering around the materials. The main symptom I experienced is that I will start crying because I think I'm going to die. My kind of cry makes my body and lungs feel sore. This is not just a problem because her feelings are repressed, and the fears could take many years before her normal feeling is back on track. Whilst a lot of people have become more anxious during the Covid-19 lockdown, Kemp's story highlights that for some of us the pandemic has sparked or rather amplified severe mental health problems. Psychologists are, however, raising concerns that these effects may linger in a longer term. And the author of Psychology of Pandemics and Professor of Psychiatry, Stephen Taylor, University of British Columbia, has argued that a sizable number of people, around 10 to 15%, will not return to normal because of the impact of Covid-19 on mental health. An independent mental health institute, Australia's Black Dog Institute, also raised concerns about the increased minority who will be affected by severe anxiety over a period of time. In the UK also, British Medical Journal has also published that the mental health effect of the pandemic will likely be longer than its physical impact. From an historical standpoint, one of the concerns of people with the issues surrounding the long-term effects of coronavirus stems from previous existing insights from history, experiences from pandemics and national emergencies. In 2003, the SARS global outbreak was associated with at least 30% higher suicide rates among people aged 65 years of age. Quarantine as a strategy necessary to mitigate the spread of the virus can significantly have negative psychological effects on people such as PTSD, anxiety, insomnia, and depression. In fact, job loss and other financial struggles during the global economic recession has been associated with decrease in the quality of mental health. From a history standpoint, the negative mental health effects of disaster affects people more and can last even longer than the health implications, close quotes. According to Joshua Morgenstein, Center for the Study of Traumatic Stress in Maryland, US, open quotes, "If history is our predator right now, then we should anticipate a tale of mental health needs to proceed long after Covid-19 is resolved," close quotes. Citing key research, a 25-year retrospective review of the impacts of Chernobyl nuclear disaster in Ukraine, it was discovered that 2 decades post-event, first responders to the event had higher increased depression rates and PTSD. Researchers also concluded that mental health effects were the most significant consequence of the disaster that resulted in the death of thousands and damaging of the region's economy. Likewise, the research suggests mental health crises such as PTSD and stress, which is an issue for people who have lost their property during the New Orleans Hurricane Katrina, when assessed 5 years later after the sad events. The report was exaggerated among the people with poor mental health or low income before the hurricane struck. What are the long-term problems that will be linked to Covid-19? Among many mental health issues associated with Covid-19 pandemic long-lasting effects, psychologists have found obsessive-compulsive disorder to be one of the top problems. Taylor explains OCD could have a lasting impact because it arises from interaction between genes and environmental factors. People with genetic predisposition towards OCD, such as obsessive cleaning, are likely going to be triggered by the Covid-19 pandemic. Some of those people will develop chronic germaphobes except they begin to receive adequate treatment. In line with the OCD resulting from anxiety, general anxiety is also a very key issue needing attention, said Yuko Nipododa, a psychotherapist and spokesman for the UK Council of Psychotherapy. Open quotes. There are people suffering from anxiety already, and people tending towards feeling anxious will do more easily, and at the end, the situation might get worse. Close quotes. Open quotes. Even when pandemic ends, some people will still be overly anxious due to the threat of variant strain. Close quotes. The chronic loneliness caused by social isolation and hopelessness during the pandemic is another concern, says Nipoda. Some individuals have involuntarily found themselves within fewer social relationships due to social distancing and may even find it really difficult rebuilding their existing networks. Others debilitating withdraw themselves from the outside world because they want to feel safe and as a result become reluctant to increase their social interactions in the near future. When people are experiencing stress, they tend to detach themselves from the stressful world, and once they are detached, getting into the world socializing becomes very difficult. Meanwhile, the stress impacts of living with Covid-19 may have greater mental health impact with people with painful life experiences in the past. It may trigger the memories surrounding trauma consciously and unconsciously. In this present situation, mental health conditions can become a long-term thing and can become the doorway to prevent traumatic experiences. I just have the consistent fear of losing someone, close quotes, according to Lindsay Higgins, a 35-year-old from New York who has lost her parents to suicide in 2014 and has since experiencing resurging episodes of PTSD since the pandemic began. After many years of counselling, she believed that life was about to move forward, as she says, but now gets very nervous each time her current partner leaves the house to engage in his routine. Obviously, he's not going to die when he's out, but there's still the fear that something bad might happen, like Covid-19 and getting him very ill. Close quotes. And ongoing unemployment and other financial struggles due to the global lockdown due to pandemic may impact the persistence of people's mental well-being too. Several former studies linked to depression, suicidal ideation, thoughts, and stress have been conducted. Recent data polling from the US revealed that more than 50% of unemployed or low-income earners have reported having negative mental health, as this is the same who have income cuts due to the pandemic as well. Psychologists emphasizing that the unforeseen nature and scale of Covid-19 crisis adds more layers of uncertainty compared to the global financial crisis. Until vaccines are provided, it remains devastating if industries and businesses which have been badly hit by the pandemic will recover. Nipoda explains that this presents a challenging situation for individuals who cannot deal with uncertainty or are struggling to handle uncontrolled situations. We live in uncertain times presently. Some people are fearful towards uncertainty and the unknown, and this fear is prolonged. What do we need to learn? Historians can judge the truth of the predictions and expectations. Various organisations and schemes have created guidance to tackle the issue. Earlier this year, the World Health Organization published recommendations for safeguarding mental health. Similarly, another guideline has been published by the UK and US governments, as well as governments of other countries. This month, the American Psychological Association released their report on the lasting impacts of the pandemic on stress and how people cope with the period of uncertainty like this. Researchers are also gathering empirical evidence with the hope that the data provides a better grasp of the long-term side effects of mental health during a time like this and how to manage it. Major studies in the UK are also looking specifically at the mental health hospitalisation patients of Covid-19, with the nurses working on the front line. In Sweden, some researchers from the Centre for Psychiatric Research in Stockholm are also conducting a year project involving more than 3,000 participants with pre-existing mental health conditions involving depression, OCD and anxiety. An Australian national survey by the Matilda Centre for Research in Mental Health in Sydney is also assessing the impact of the pandemic on continuous mental health and well-being of the population. There are concerns that the mental health problems that may arise, but the rising nature needs to be understood. Operations manager for the Stockholm project, according to her, the Swedish research focuses on how much Covid-19 may exacerbate the already existing inequality of mental health, how patient symptoms develop or change over the next few years, and which groups are most affected. Open quotes. We are also investigating the factors contributing to resilience, which is an important risk factor. Close quotes. Joshua Morgenstein from the Center for the Study of Traumatic Stress in Maryland argues that these projects and the essential resources for both the healthcare providers and government, open quotes, healthcare surveillance of different populations to understand these aspects of risks is important so that we can provide interventions for and plan for subsequent pandemic waves as well as the future public health emergencies, close quotes, he said. Stress can be likened to the toxin like lead or radon. In order to understand it and how it's affecting society, it is pertinent to know who is exposed and how they were exposed, when was exposed, how was exposed and how much was exposed, and what effects were caused by the exposure. Although there is little data so far, Morgenstein predicts that long-term studies are more likely to further reveal the well-being differences across race, gender and income, all of which have been highlighted during the pandemic, and they need to be taken into consideration when developing future responses. The benefit of resilience and hope. Despite the global concerns about the issues surrounding mental health challenges caused by the Covid-19 impact, psychiatrists have come out to say that there is some positive benefit to it. Taylor argues that while a large minority may experience long-term struggles, the pandemic has taught a high level of resilience to stress and in the general population. And this is alongside humans' capacity to recover after catastrophic events, for example, in Wuhan, where the pandemic broke out and cases brought under control after the 76-day lockdown, including mass testing. The city stated a loud water park music festival in August. Thousands of people gathered together, shoulder to shoulder with no masks or no social distancing rules. Also, large gigs returned to New Zealand after community transmission of the revised virus was controlled. We see that these events have taken place despite the fatal mood in January 2020, when many people were unsure if life would return to normal, while some speculated about Dickens' post-traumatic world. Similarly, events and gatherings will occur in every part of the world as soon as the pandemic is over, Taylor noted. Psychotherapist Nipoda suggests that for some individuals, the adverse circumstances of the pandemic have really had a positive impact on their mental health, which may be lasting. The lockdown experience has helped people to reduce anxiety levels and stop panic attacks among people with high levels of stress associated with daily engagement before the pandemic. This is because, to them, they have a greater sense of freedom and safety by spending more hours at home. Although some social isolation and loneliness are risk factors for those who retreat too much, she opines that the enforced lockdown has helped strive for better work-life balance in the future and has enabled them to do things at their own pace in life when it comes to socialising, e.g. finding the right comfort zone and indoor and outdoor boundaries. Others have also used the period of social distancing to declutter their house, and the new space within the house has been thought about with positivity and with the mind as something they can clean up if their heads were the same, says Nipoda. The pandemic has helped increase time for those people to find and develop their hobbies. For instance, making and doing things from the beginning is thought to provide in a person a sense of fulfillment, satisfaction and stress relief. But these experiences only ring hollow in the ears of people like Susan Kemp, who is still struggling to picture her end to her chronic mental health challenge caused by the pandemic. Obviously, there is a need to have some balancing between the cautious and the total hermit that I am not able to achieve, she says. But open quotes. But I irrationally can't overcome my fears. These days, it's hard to choose when I'm being rational or irrational, close quotes. open quotes. I find it very tough to rebalance and reintegrate myself, close quotes. Lindsay Higgins, who positions that she's unsure if her symptoms will subside and improve if vaccines are created, open quotes. Vaccines distribution will take time, and it will be longer convincing other people to take the vaccine. Truly, I am uncertain if I'll ever feel secure ever again, close quotes. Never act on any advice given in these articles, videos or audios. Always seek professional help before acting on anything you read or watch or listen to on this website, or in our podcast, or on our YouTube channel, or anywhere on our social media.